To my practice, I guess I was very happy to hear about the number of practitioners who have been using this device, Stable Lab, for the horses showing or racing, performing, which is more my field of play. Well, I'm going to use Stable Lab nowadays on horses who are supposed to ship for a long term, like more than 8 hours. Horses who have to maybe go from the temperate climate to a very hot climate. Because the problem we are facing is this is where we get most of the shipping fever. The number two place would be when the horses have been performing. So as I said during the meeting is I like to use the lactate and combine with the SAA. If a lactate looks good, then I'm going to put the SAA on the top to see if everything is fine. Especially if a horse has been not exactly performing the way it should have been. And definitely when the horse has been shipping and arriving to a place, does not eat well, looks okay, jogs okay, but you just want to make sure everything is fine before he's going to start the competition. You know, I don't use fibrinogen as much, and I'm not in such a culture at the moment because I find out to be not dynamic enough. Stable Lab in my hands for the horses that I take care of, which are mostly horses performing and doing good. I try to be more on a preventive scenario where I want to be ahead of problems, and therefore the SAA are more dynamic. So I prefer the SAA and Stable Lab. Yes, the clients, when they see that something is maybe just abnormal or suspicious, they now are demanding for this extra test because they get to know the test more and more. And that's why I have been able, with a few clients that I really trust, to give them the device in an emergency box. So they have a few Stable Lab kits that they might use on my demand. So they would not overinterpret the case and not definitely treat the horse without having my agreement. But in my hands, it's nice to have a tool that I can use when I am not there and see if something is going or pending.